What if your heart started to beat rapidly and irregularly? You started to feel weak, faint, short of breath? You might have an electrical problem in your heart called atrial fibrillation or AFib. My name is Martin Sklar. I am President and CEO of AblaCor Medical Corporation. I'm going to discuss atrial fibrillation and an innovative product that we are developing to improve a treatment called ablation. The link can be found on our website, AblaCor.com. What is atrial fibrillation? AFib is the most common irregular heartbeat. It is caused by an electrical problem originating in the pulmonary veins. In this illustration, the left diagram shows the electrocardiogram of a heart in normal rhythm. The illustration on the right shows the electrocardiogram of the irregular rhythm pattern of a heart in atrial fibrillation. AFib is a progressive disease affecting 6 million people in the US and 30 million worldwide. It is the cause of 20% of all strokes and is linked to congestive heart failure. One treatment option shown here is to ablate or burn tissue in the heart. A device called a catheter is used to block or isolate the irregular electrical signals originating in the pulmonary veins from reaching one of the top chambers of the heart, the left atrium. This procedure is called pulmonary vein isolation, or PVI, and is performed in the beating heart. The device in this illustration is a point ablator catheter that is the most frequently used technology for PVI. This catheter allows the physician to remotely control the ablator tip to make multiple overlapping points around the pulmonary veins. The procedure is long and tedious to perform. Problems with point ablators make it difficult for doctors to keep the instrument in contact with the heart tissue during PVI. They require physicians to continuously apply pressure to maintain contact between the ablator and tissue during ablation. If unsuccessful, gaps can be left in the ablation line. Currently, 2 out of 5 of the AFib ablations performed each year in the US are repeated because of AFib recurrence. AblaCor's solution is the circumablator shown in this illustration. Our concepts have been endorsed by physicians at major medical centers. The circumablator is a circumferential ablation catheter. This means that the catheter is positioned around the opening of the pulmonary vein. It maintains stable and consistent tissue contact throughout the entire ablation procedure. With one touch of a button, the circumablator can make a complete ablation the first time, eliminating the need for repeat procedures. A complete ablation that blocks irregular signals from reaching the atrium can cure AFib, especially for early-stage patients. The major features that differentiate the circumablator catheter from other AFib ablation catheters include the anchor, the umbrella ablator, and its individual electrodes. We anticipate that procedures will take half the time, patient outcomes will be significantly improved, and costs reduced. This illustration shows the results of a complete ablation performed by the circumablator. With its consistent ablator tissue contact and precise energy delivery into heart tissue, the circumablator will simplify ablation procedures. This will attract more physicians to perform PVI. Our patent-pending system will make ablation easier, faster, and more reliable for millions of patients with AFib. This picture shows results of tests that AblaCor recently performed. See the continuous linear ablation line in Figure 2A? Compare that to the gaps created with the point ablator in 2B. Gaps allow leakage of the irregular electrical signals. This can result in AFib reoccurring, repeat procedures, and potential for the risk of stroke. In summary, AFib is the cause of approximately 20% of all strokes. 40% of AFib ablations are repeated at least once, and many a second time due to incomplete ablations using current ablation technologies. As a result, AFib can reoccur. The circumablator will simplify and shorten ablation procedures and improve patient outcomes. It will eliminate or reduce the AFib burden and stroke risk. It may also reduce the incidence of congestive heart failure. We anticipate that physicians will be able to care for more patients since procedures will be shorter and fewer repeat ablations will be required. We ask that you consider contributing to our campaign to help us build catheters so we can perform more advanced tests. We look forward to improving the quality of life for millions of patients with atrial fibrillation and to help physicians perform easier, safer, and more effective ablations. Join AblaCor to help keep you in rhythm. For further information, please go to our website, www.ablacor.com. Thank you.